Thank you, Chairman Sir. I rise to support the Mental Health Care Bill 2016. Sir, in our country, we see in most of the cities, people with mental illness are wandering on the streets. Nobody is there to take care of them. But sir, this Mental Health Care Bill 2016 has made a special provision for all these people who are suffering with mental illness and are wandering on the streets. Sir, the bill makes a provision that the police officer who's in charge of the police station, in whose area people are wandering at a large scale, he can take them under protection, and those people will be subject to examination by a medical officer. And if their residence is known, those people will be taken to their residence. If their residence is not known, those people will be taken to establishments like establishments for homeless persons. Sir, further up, if a police in charge of a police station, if he thinks that such person who is suffering from mental illness is ill-treated or is being neglected, he can report such cases to the magistrate, and the magistrate can ask for a report and pass an order to cause the person to be produced before him to be subsequently examined by a medical officer or a mental health professional, or be provisionally admitted to the mental health establishment. So this bill also provides that whenever during a judicial process a proof of mental illness is being produced and the same is challenged in the court of law, the court shall refer such cases to the Mental Health Board, and the board will submit its opinion to the court. So this bill also guarantees a right of affordable, accessible and quality mental health care and treatment for mental health services run or funded by the central and the state government. The bill also makes a provision for a range of services to be provided by the appropriate government. So when a person is suffering from mental illness, this comes with a stigma that this person is mentally ill. But sir, this bill, Mental Health Care Bill 2016, has addressed this issue by having a holistic approach of treating the people with mental illness and empowering such mentally ill persons. The bill seeks to remove the stigma attached to mental illness. It makes efforts to secure equal treatment for persons with mental illness just like people with other physical illnesses. So the bill also allows a mentally ill person to have a nominated representative. Sir, in some diseases, when a person is suffering from mental illness, he might change the nominated representative every now and then, sometimes maybe 2-3 times even in a day. And in such cases, the cases will be given to the Mental Health Board, and the Mental Health Board has been given powers to decide whether the nominated representative that has been nominated by the mentally ill person should be considered or should be rejected. And this needs to be done in a very short time, as it will enable the treatment. So this bill makes a very good provision for people suffering with mental illness. So when a patient is treated in a hospital and the active management part of the patient is completed in the hospital and he doesn't require any longer stay in the hospital, such patients can be sent to halfway homes. Sir, halfway homes is something where a patient is not completely well, but he is in a dischargeable position and he can be discharged, but not fit to stay at home, or in the circumstances in the house, it might affect his illness. And in such cases, these halfway homes are established. Sir, in our country, not many government-owned or government-aided halfway homes are there. There are most of the NGO-owned halfway homes. So I would like to request the Honorable Minister through you that if government establishes such halfway homes or say provides aid to the NGOs who are interested in making such halfway homes, it will address the issue on a large scale. So this is, sir, also in our country, if we see most of the mental hospitals, what the bill says, the Mental Health Act of 1987 had allowed the mental hospitals to keep mentally ill patients hospitalized for a maximum period of 180 days. After second reception order by Honorable Magistrate in response to request made by the Superintendent of Mental Hospitals. So the Mental Health Care Bill 2016 has similar provision in staged manner and does not allow a stay during admission beyond 180 days. Sir, in such cases, sir, practically in our country, many such hospitals are there, specially meant for the mentally ill patients, where patients are dumped more than 180 days. So 180 days is the prescribed time when a person has to be in the mental hospital. But sir, sometimes relatives don't come to take the patients. And in such cases, those patients can be kept in the halfway home. So again, sir, this is a welcome step that halfway homes will be created under this bill. Sir, also another important provision that the bill has is about the rehabilitation. So the prevalence of major psychosis is 1 to 2% in our country. It constitutes of disorders like schizophrenia, mania and psychotic depression. Schizophrenia poses a major problem in management as a majority do not recover completely and show deficits and hence do not return to pre-morbid level of functioning. So the bill mentions about rehabilitation, the bill mentions about providing support to the families of people suffering from mental illness. So also chapter 5 of this bill, section 18(4), subsection C and D, it provides for rehabilitation of people with mental illness in all the spheres of functioning. But sir, through you, I would like to know from the Honorable Minister if he can throw some light on vocational rehabilitation. Because sir, vocational rehabilitation is not being mentioned in the bill. And in some cases, like I said about schizophrenia, in some burnt out cases where despite giving them treatment, the mentally ill person does not return to his normal cognitive ability, and in such cases it is very much required for that person to lead a normal life. He should have vocational rehabilitation done. So Honorable Minister should throw some light on this aspect as well. Sir, this bill is very good in the sense it has covered almost all the aspects of a person suffering with mental illness. But sir, while talking about providing care to mentally ill persons, I think there are certain parameters that one should look at. Psychiatric illness treatment is basically a team treatment. It is not just one doctor giving medicine and the treatment is done. It requires clinical psychologists, it requires social workers, it requires counselors, it requires psychiatric nurse other than the psychiatric doctors. Sir, I would like to highlight some important numbers in our country. Sir, today in our country we have 25% medical colleges in India which do not have psychiatry department. 289 institutes, they provide undergraduate teaching. 151 institutes, they provide postgraduate training facility. Sir, there are total 302 postgraduate seats of psychiatric illness, out of which MD seats are 159, diploma seats are 107, DNB seats are 36, but there is no PhD seat in our country. Sir, apart from this, the budget provision is less than 1%. As compared to 18 to 20% in the Western world. Sir, I really appreciate Honorable Minister's efforts. He has announced the National Mental Health Policy in 2014, which takes care of all these issues. But I think, sir, these numbers have to improve. Like I already said that this is a teamwork. Sir, talking about human resources, number of psychiatrists in the country as of today is around 4,500. Sir, today in our country we require around 12,500 psychiatrists. That is what is required. Sir, number of psychiatric nurses today is 0.04 per 1 lakh, which is around 3,000. Number of clinical psychologists is around 0.02, which is per 1 lakh, which is again around 2,000. Number of psychiatrists, social worker is around 0.02 per 1 lakh, which is again around 2,000. So total, sir, other than doctors, these other paramedical personnel that we require in the treatment of psychiatric illness are around 7,000. Sir, the number that we require today is around 56,000 of these paramedical personnel we require in the country. So I urge upon the government that these numbers should also be taken into consideration for effective implementation of this mental health care bill. Sir, in this mental health care bill 2016, the qualification criteria for psychiatric nurse, psychiatric social worker and clinical psychologists are made simpler so that the qualified staff will be easily made available. Sir, this is a welcome step that has been taken. Sir, also all we need today is, there are only for doctors we have Medical Council of India. This is the registering body. For nurses, we have nursing council as a registering body. But sir, other paramedical staff that is required in this treatment of psychiatric illness, there is no designated council for these people. Sir, what happens now? We are talking about mental illness patients. There can be legal issues coming up when the treatment is going on, because sometimes the patient is not able to understand, and the person who is giving treatment, or say the paramedical staff he is not registered under any council. There can be legal issues coming up. So I think, sir, we should consider about those councils as well. Sir, for research, there has been a provision made. Mental Health Care Bill 2016 allows persons to take part in clinical research. Research is a very important part as far as mental health care is considered. Sir, in this, the consent of the patient should be taken before doing any kind of research on that person. And sir, in case if the person is not able to give a consent for being included in the research study, then the concerned state authority should give this permission for including that person into the research. Sir, I think the person with mental illness cannot be used as experimental animal, and so proper consent should be taken from the concerned authority if the person is not in a position to give his own consent. Sir, another very good provision in the bill is, which is very much appreciable, is inclusion of Ayush. Sir, Ayush is Ayurveda, Unani, homeopathy, Siddha, naturopathy has been included in this bill. Again, a very welcome step. Sir, in this, I am very happy to share with this August House that this decision of including Ayush into the mental health care was first taken by the state of Maharashtra, the state that I represent, and I am glad that this has been included in the mental health care bill as well. Sir, this bill also mentions about research methodology as to how the procedure of how to do research. But sir, again, through you, I would like to request the Honorable Minister that we have to prioritize the areas in which we have to do research. Sir, we have included Ayush, we have included allopathy, Ayurveda, homeopathy, Unani, Siddha, naturopathy. All these pathies should have the best of research done in their respective areas, and I think, sir, that will be for the benefit of the mental illness patients. Sir, it is appreciable, like I said, that the National Mental Health Policy has been announced by Honorable Minister Nadda ji, and also keeping in mind that there is shortage of doctors in the country, he has provided funding for almost 15 centers of excellence and 35 PG training departments, which is again, sir, a very welcome step. And sir, district mental health program has also been extended to 118 districts in this 12th five-year plan, in addition to the 123 districts which was initially included in the 11th five-year plan. Sir, the funds have been increased from rupees 56 lakhs to around 83 lakhs, which is almost double. So this is showing that the government is really interested in taking care of the mentally ill patients and is thinking in terms of improving the mental illness patients' condition. Sir, what bothers me is that Honorable Minister in his speech, he mentioned about mentally ill mothers can keep their children with them. Sir, this is one of my concerns, that in some cases like bipolar diseases, in some cases like schizophrenia, it is not advisable that the child should be kept with the mother. And sir, in such cases, since the bill doesn't speak anything on this, sir, my request to you will be that such cases should be referred to the Mental Health Board, which will take a call on whether the children should be kept with the mentally ill mothers or not. So, sir, lastly, I would like to specially thank the Honorable Minister for specially making a provision in the bill of punishing those people who are not following the bill. Sir, unless and until a person has a fear of getting punished, he will not do anything that is in the law. And sir, I am glad that there is a special provision of imprisonment as well as fine to all these patients. And sir, with this, I would like to say that this mental health care bill is in a true sense getting a chip in for the mentally ill patients. Thank you very much.